The CDC says more than 200,000 residents and staff of nursing homes have died since the pandemic began. In response to that, the Biden administration is proposing new regulations that some nursing home operators say could put them out of business. Steve Shaw joins us now with both sides of this issue. Steve.
Rich, there are 296 licensed nursing homes in the Sooner State. An organization that represents many of those tells me the new proposed regulations is an overreach that will put some nursing homes, including many in rural areas, in peril.
Every Tuesday afternoon, the Red Hatters Association meets to catch a movie inside Golden Age Nursing Home just outside of downtown Guthrie. Golden Age has been here since 1961. They started with just 10 beds. They now serve 125 residents. They're locally and family owned.
I love taking care of the elderly. It's the most rewarding job in the world.
At least partially in response to the pandemic, the Biden administration earlier this month proposed more regulations. They include making it mandatory that a registered nurse is on the floor and available 24 hours a day. Right now, that number, at least here at Golden Age, is 8 hours a day.
This will be a significant failure that will hurt seniors if this goes into effect.
Stephen Buck is president of Care Providers Oklahoma, which is the largest trade organization dedicated to long-term services. Buck also served as Governor Mary Fallon's Secretary of Health and Human Services at the end of her administration. He says several nursing homes around the state shut down since the pandemic because of the lack of qualified employees. Yet he says the Biden administration wants the Sooner State to add 800 to 1,000 registered nurses to its workforce. And despite aggressive campaigns to recruit nursing students, it will take time.
So our economics don't make sense in the current environment. And then if we have a mandate to hire more when the workers aren't there, it's going to be a debacle.
Buck says because of the government Medicaid and Medicare formula already used that pays for more than 3/4 of patients' bills in nursing facilities, nursing homes already operate at a deficit.
If the government were to move through with this, as it's currently phrased, there's a phase-in period. At the end of that phase-in period, if they don't make adjustments to the current proposal, if you're an LPN, I don't know where you'll fit into the employee mix, but we will have to identify RNs to meet the mandate requirement. And in buildings that can't fulfill the mandate requirement, quite candidly, they'll either have to restrict access or, in many cases, close.
Wes Bledsoe's not so sure. He founded the organization Perfect Cause after he says his 86-year-old grandmother died tragically in an Oklahoma City nursing home 23 years ago. He says the new Biden regulations actually don't go far enough. And he says most of those who own and operate nursing homes have plenty of money.
Staff is also often treated like indentured servants. They're verbally abused frequently. They're threatened to be fired often if they refuse to work extra shifts. They'll be getting ready to go home from their shift. A staff member will come up and say, if you go home, you're going to be fired. This person has kids, family they need to take care of. They have other plans.
Bledsoe also claims Oklahoma nursing home employees have a 60% turnover rate.
So why do they have problems retaining staff? It's because staff can't succeed at their job. There's not enough staff to do the job that needs to be done.
The employee turnover rate is an important metric. As an association, we don't evaluate that, but I will share with you that our operators keep very, very close tabs on that.
Bledsoe also claims from data that he says goes back to 2014, at least 50% of the people who enter Oklahoma nursing homes for skilled care or rehab have adverse consequences unrelated to the original reason they entered the facility. and many of those never go home.
It's time to start being honest with the people of Oklahoma and tell them what they're up against.
So the first thing I would say in response to that is I wasn't actively involved in the sector of 2014, so I would have to see that data to have the right context on it. But again, what I will take you through, and this is CMS data, this is not our data, it's not sector data, it's CMS, Center for Medicaid and Medicare Services. I will go back and report on the very specific 4 areas that we were tasked with by the legislature in 2019 to seek improvements. UTIs, urinary tract infections, pressure ulcers, antipsychotic use, and then the 4th was weight management. Those 4 areas. Those 4 areas are central to the health and well-being of the residents that we serve. We have made improvements in each of those 4 areas. In 3 areas, double digits relative to other states, and we're now #1 in the country on weight management, the best.
Buck says his father passed away 2 years ago in a nursing home in rural Oklahoma. When his dad was in hospice care, Buck says his dad's wife was just 5 minutes away.
If we do this mandate as proposed, and if rural buildings are unable to survive because of the intensity of the mandate, my stepmother, my father's mother, or my father's wife, she would have had to have driven a minimum of 30 miles each way to access care in the nearest building. I don't think that's what we want for our rural Oklahomans.
Buck says the Centers for Medicare and Medicaid Services will make a final determination what any of the new nursing home rules are sometime next year.